Hello, folks. I'm back again for another tip in our MET 101 ebook series, and this is tip number 52. How and when do I discharge a MET client? Okay. When clients are finished with the MET program, they may be discharged or moved into functional maintenance. Now, we talked about this in tip number 51. When the client is released from medical exercise training, a discharge summary is forwarded to the client's physician with exercise recommendations. So when they've gotten to the point, folks, they don't need your level of expertise as a medical exercise specialist or post-rehab conditioning specialist or program director or advanced MES. They're to the point now you can use just your personal training skills or just your fitness skills. Guess what? They no longer are a medical exercise training client. And you can discharge them, but it doesn't mean you throw them away. It means you continue to work with them at maybe a lower level of intensity, maybe a lower level of cost. I don't know which one you may do, but now the client is more of a maintenance client. So let me continue on with this. In the functional maintenance phase, the client may purchase a medical membership. Maybe you have a facility, you have a medical membership where the client comes in, or continue with one-on-one training without a focus on their medical issues. Their issues now are just simply maintaining their level of function. Folks, the goal of every healthcare provider is to get the patient, and remember you're dealing with clients, but to get the patients to the point they don't need our care anymore. They just need supervision or periodic check-ins. The same thing should hold true for medical exercise professionals. And I think what's happened along the way, and we need to be careful about this, we get this medical exercise training client, we want to hold on to them because we could charge a higher level. Well, folks, at some point they get to a level where they're just a regular exercise client. They're doing well, their function has improved, their power, their strength, their proprioception, and they're doing pretty well. That doesn't require the same level of critical thinking that you learned in the medical exercise specialist workshop or in the advanced medical exercise specialist workshop. You now can use the same skill used as a personal trainer, which theoretically should translate into a less intense exercise program, but also a program that doesn't require the same level of critical thinking, which may mean it requires a more economic level that you're charging them. Now, I'm not saying that you have to do that, but I think we find as more and more individuals are starting to use medical exercise training services and insurance carriers are starting to pay for it, they're realizing that smart money says after they're finished with therapy, after we've done this medical exercise training thing, smart money says let's keep them in a functional maintenance program provided by a medical exercise specialist or post-rehab conditioning specialist so we don't regress and we have any worse problems that now will pop up and now the client needs hospitalization. So the discharge summary is forwarded to the referral source within 48 hours of the discharge of the client from medical exercise training services, but it doesn't mean you have to now stop seeing the client. You just step them down. Let me explain step down. Individual goes into the hospital and has a hip replacement. The insurance carrier says at maximum we're going to pay for 48 hours of post-operative care in the hospital. The reason? As the client is healing and they're getting better and they're stabilized, we want to move them out of the hospital, which is costing $3,000 or $4,000 a day. They then move them to a skilled nursing facility where the cost might be $1,000 a day. The client can now get skilled care, physical therapy, occupational therapy, everything else, speech therapy if necessary, and the cost is cheaper. And when the client reaches a level of function where they now can go home, okay, we discharge them to home, and now they're at home. It's not costing anybody anything. Maybe they have a home health nurse that comes by periodically, or physical therapy, or occupational therapy comes by twice a week. Again, the cost is lower, but the client is making functional gains. Folks, if we really want to be part of the healthcare network, we now have to play by the same rules that the medical providers are playing by, which means we discharge our clients from medical exercise training services, but we can still work with them in a functional maintenance program, which we talked about in an earlier tip, or at a personal training level that doesn't require the same amount of intense critical thinking as a medical exercise professional. It allows you now to regress back to doing personal training. So with that said, thank you for watching. Please go over to MET101ebook.com. Get a copy of the ebook. It is free. I guarantee you it'll help you with a lot of things you need to know as far as building your medical exercise training practice. And it's based on 28 years of medical exercise professionals around the world asking us questions with regard to building their practices, developing relationships with medical providers, and most importantly, producing outcomes for their clients. If you have any questions for me, please email me at drmike@postrehab.com, and I wish you well in building your medical exercise training practice. Thank you for watching.